Almost 90% of people who suffer out-of-hospital cardiac arrests die. CPR, especially if performed in the first few minutes of cardiac arrest, can double or triple a person's chance of survival. If you were swimming one day with your friends and one of them stopped breathing, you would want to be able to save their life. I am certified in CPR and I have taken the CPR course twice. By knowing CPR and first aid, you could save somebody's life one day. I will now give the exact steps for both CPR and first aid. First, let's talk about CPR. Cardiopulmonary resuscitation is a life-saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association uses the acronym of CAB, Compressions Airway Breathing, to help people remember the order and to perform the steps of CPR. Before beginning CPR, check. Is the environment safe for the person? Is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulders and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, one should call 911 or their local emergency number, and one should begin CPR. If you are alone and have immediate access to a telephone, call 911 before beginning CPR. First, put the person on his or her back on a firm surface. Next, kneel next to the person's neck and shoulders. Then place the heel of one hand over the center of the person's chest between the nipples. Place your other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, as you push straight down on the chest at least 2 inches, but not greater than 2.4 inches. Push hard at a rate of 100 compressions per minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical professionals take over. If you are trained in CPR and you've performed 30 chest compressions, open the person's airway using the head tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt back the head. Then with the other hand, gently lift the chin forward to open the airway. Check for normal breathing, taking no more than 5 to 10 seconds. Look for chest motion, listen for normal breath sounds, and feel for the person's breath on your cheek or ear. Gasping is not considered to be normal breathing. If the person isn't breathing normally, and you are trained in CPR, begin mouth-to-mouth breathing. If you believe the person is unconscious from a heart attack and you haven't been trained in emergency procedures, skip mouth-to-mouth breathing and continue chest compressions. Although some may say the chances of you actually having to perform CPR are slim to none, just think maybe one day you have to, and the difference between you knowing and not knowing is someone's life. Now that we've talked about CPR, we're going to talk about first aid. To perform first aid on cuts and lacerations, it is important to follow the steps very carefully. Call 911 if a cut is bleeding severely, blood is spurting out, bleeding can't be stopped after 10 minutes of firm and steady pressure. In general, a cut that needs stitches should be repaired within 6 hours of the injury. The exception is cuts to the face and scalp, which generally can be repaired to 24 hours after the injury. Take the following steps for minor cuts. First, stop the bleeding by applying direct pressure on the area. Second, clean and protect. Clean the area with warm water and gentle soap. Apply an antibiotic ointment to reduce the chance of infection. Put a sterile bandage on the area. In some people, antibiotic ointments may cause a rash. If this happens, stop using this ointment. Third, call a healthcare provider. Call a healthcare provider if the cut is deep or over a joint, you cannot get the cut or laceration cleaned, or if the injury is a deep puncture wound, or if the person has not had a recent tetanus shot or booster, or if the cut is from a human or animal bite. Fourth, follow-up. For a minor cut or laceration, remove bandage after a couple of days to promote healing. See a healthcare provider if the cut doesn't heal or show sign of infection, including redness, swelling, pus, or excessive pain. Now that we've discussed CPR and first aid for cuts and lacerations, let's discuss first aid for choking. The Heimlich maneuver is one of the most frequent life-saving aids that's taught today. It's been included in first aid classes, and it is taught by the Red Cross. Choking is the fourth leading cause of accidental death in the United States, so it is very important to know the Heimlich. Call 911 if the person is choking, the person is having trouble breathing or has noisy breathing, or if the person is unconscious. While waiting for CPR, give 5 back blows. Second, if the person is still choking, do thrusts. If the person is not pregnant or obese, do abdominal thrusts. Stand behind the person and wrap your arms around the waist. Place your clenched fist just above the person's navel. Grab your fist with your other hand. Quickly pull inward and upward as if trying to lift the person up. Perform a total of 5 abdominal thrusts. If the blockage is still not dislodged, continue cycles of 5 back blows and 5 abdominal thrusts until the object is coughed up or the person starts to breathe or cough. Take the object out of his mouth only if you can see it. Never do a finger sweep unless you can see the object in the person's mouth. Third, give CPR if necessary. If the obstruction comes out but the person is not breathing, or if the person becomes unconscious. In conclusion, CPR and first aid are vital skills in knowing how to save lives. By knowing the exact steps for CPR and first aid, you have a better chance of saving someone's life. About 400 cardiac arrests happen every year. Maybe one day, it'll happen in front of you and someone's life will be in your hand. Will you know how to save them?